and then we can start.
Okay.
So you were on time.
All right.
Yes.
Okay.
Yes, time now to start. And welcome. Welcome to Medical Mondays with Dr. O. What an amazing day again to, get together and come to learn. I'm Tony Okwesomi. I'm a family practitioner, HIV specialist, and I treat addictions in Maryland. I host this program to learn myself and also to share knowledge that I may have. Tonight, we have one of our very own, Dr. Oluwole Ajagbe, our own dental pathologist who was chief at Howard University for over 21 years before going into private practice, who does interventional and conventional dentistry, is a man with a wealth of knowledge, as every one of us on the platform would know. And we are blessed to have him tonight for a very special topic. This is an unusual topic. It was a topic sent to me by one of our Medical Mondays family members, asking about the use of mouthwash and the danger to health of mouthwash. So I chatted with Dr. Ajagbe and he said, using mouthwash may worsen your blood pressure. That is news to me. So I said, you know what? Can you talk to us about it? He said, would you like us to talk about that? Would you like us to chat about that? And so here we are. I'm yielding the floor to Dr. Ajagbe. And please complete your introduction because I know I didn't do a great job. And take over the floor, sir. And welcome, sir.
Thank you, everyone. I'm grateful to be here with you tonight. Yes, my name is Oluwole Ajagbe, and I'm a dentist. Primarily by profession, I specialize in oral and maxillofacial pathology and implant dentistry, and also dental sleep medicine. So tonight, I want to take us to one area that maybe everybody on the platform is guilty of it, or maybe they have a habit of doing it. And this topic is very important, but it's often overlooked because most people don't know that there could be anything adversarial coming from something that seems to be so good. And I'm talking about the use of mouthwash. So can everybody hear me?
Yes.
Hello? Can everybody hear me? Okay, thank you.
Yes, we can.
So,
yes, we can hear you.
All right, great. So tonight, what we're going to talk about is, can the use of mouthwash actually predispose somebody to having high blood pressure? That's one question. And the other question is, does it make the blood pressure that somebody already has to become worse? Wow. I think that is something that everybody should be excited to listen to. So tonight, I'm going to try to take us through a little bit of conversation that will help us to see whether this is very important. Can everybody see my video? Because I can't see myself. I don't know what's going on, but
we can see you.
If you
can hear you clearly.
But you can see me too, right?
Yes.
Okay, good. Because I can't see myself, so that's why I wanted to be sure.
That's because you're speaking from Nigeria. You're speaking from Nigeria, and it is what it is. I want you.
Yeah, that's fine.
To do this. So, well, we can see and hear you very well.
Okay, that's fine. So let's go. So maintaining our oral hygiene, a good oral hygiene is essential for overall health. So we all know that. And for many of us, we are familiar with the Surgeon General's report on oral health. David Satcher, many years ago, when he was the Surgeon General for the United States of America, actually articulated that as his own report for his office at that point in time. So now we know that the mouth and the teeth don't exist on their own. They are part of the whole body. But for the sake of economic planning, the mouth is separated from the rest of the body for insurance purposes. And that is very unfair, and it's very unfortunate that they did that. I believe very soon some things will change, and there will be a revolution to bring the mouth back into the body of human beings. So in America, the mouth exists and the other parts of the body exist together. Anyway, so we want to keep our mouth healthy. Keeping our mouth healthy will keep our overall health to be in tip-top shape. However, there are recent research studies that suggest that the habitual use might have unintended consequences. Hello? Did you say something, Dr.?
No, we can hear you. I muted the person.
Okay. Okay, thank you. So, however, recent research suggests that the habitual use of mouthwash might have unintended consequences, particularly concerning blood pressure. So, we know the role of mouthwash in oral hygiene. We know that if we use mouthwash, particularly the ones that have mint, the ones that have, some other additives that freshens the breath. We know that many people use the mouthwash because of that. They did not know that the mouthwash actually, particularly the ones that have three components. The first one is chlorhexidine. The second one is cetylpyridinium. And the third one is actually alcohol. So if you're using any mouthwash that has any of those three, they are not just innocent mouthwashes. They are targeting bacteria in the mouth. And unfortunately, these products are equal opportunity eliminators. That is, they do not discriminate between harmful bacteria and beneficial bacteria. So unfortunately, as you say, oh, I'm using the mouthwash. What brand of mouthwash should I use? You're my dentist. Tell me the best mouthwash to use. All of these things is based on the fact that we believe that mouthwash is not harmful, that is very beneficial. But now research studies have shown that that may not necessarily be the case. Now, it is not the efficacy of the mouthwash against the bacteria that is bad, because that's very effective, but the effect on the blood pressure is the problem. And that's an unintended consequence of using the mouthwash to keep the mouth healthy as well as fresh, and then, having a fresh breath, So how could something so good become so dangerous to our overall health? Well, so let's understand what mouthwash really is. The mouthwash is nothing but, those contents that I described earlier with water. And then when it's mixed and it's used to switch the mouth once to twice a day, it actually causes the reduction of the bacteria, or what we call the oral biome in the mouth. And so that actually prevents the formation of plaque, the formation of calculus, which we call tartar, as well as cavity prevention and all of that. We can see that benefit. However, the unintended side effects of using the mouthwash, while we're getting those intended effects, is that the blood pressure becomes elevated just for people who use the mouthwash at least once a day. So there are 3 research studies I would want to allude to just to help us understand that this thing is scientifically based. What I'm sharing with you has ton and ton of research data to support what I'm sharing with you. So I don't want to bore you with details of the physiology, but there's no way I can explain this to you without talking about 3 different compounds. Most of the foods that we eat, particularly proteinous food, have nitrates in them, particularly the leguminous food, like beans, like peanuts and stuff like that. So we get nitrates even from green vegetables, whether you use it as part of your smoothie, or you chew it raw as salad, or you use it to make a egusi soup, or you use it to make a foriro, whatever you use green leaves for, you will get nitrates from that once the digestion goes through. Part of the byproducts of digestion that the body gets is the nitrates. Nitrate is a compound that the body absorbs from whatever we ingest that contains that compound. This nitrate is not very healthy for us. So the body has to convert these nitrates into an intermediate compound called nitrites. So from nitrates, it goes to nitrites. The body then uses not its own natural enzymes, but the good beneficial bacteria in the mouth do the job. The second phase of that process of the pathway is converting the nitrites into nitric oxide. That nitric oxide is one of the most life-supporting elements or compounds in our body. Every part of our body needs nitric oxide. So nitric oxide, I'm sure many of you who have heard me talk about the airway restrictions and all of that will remember that I said that the linings of the sinuses, the maxillary sinus, the sphenoidal sinus, the ethmoid sinus, all of this surround the airway, the upper airway, and those sinuses help to produce the nitric oxide, which is needed to mix with the air that we breathe into our lungs to allow for the diffusion of the air across the membrane, across the blood vessels. So nitric oxide is needed for our breathing. Nitric oxide is needed because it causes the blood vessels to relax. Without the ability to relax, the rigidity of the blood vessels will cause the blood pressure to increase. And that's exactly what has been found in some of these research studies, that the nitric oxide pathway, the nitrate, nitric oxide pathway is being disrupted by the use of the mouthwash. So the first one, I can, let me share some of 3 research studies with us. One of the ways by which the body produces nitric oxide is, like I just said, and this involves the conversion of that nitrates into nitric oxide as a final product, which the body can use. And once this pathway is blocked, because of the elimination of the good bacteria in the mouth, then the blood vessels cannot get the sufficient nitric oxide that is needed. Now, we know also that the endothelial cells, that is the lining of the blood vessels, including the capillaries, have the ability to actually generate nitric oxide for the blood vessels to be able to expand as the blood is passing through to contract and expand. Nitric oxide is very, very important in that. So now let's see, when we use the mouthwash, that is blocked, okay? Now, the first study, which was published, for example, in the journal Free Radical Biology and Medicine, found that using mouthwash twice a day for a week led to a significant increase in blood pressure in healthy individuals. Now, you see that? Healthy individuals. These are not people who already have blood pressure. These are healthy individuals that they found out just by using mouthwash twice a day for 1 week, their blood pressure increased. So which that means removing the mouthwash and repopulating the mouth with the healthy bacteria, the blood pressure reverts back to normal. So the next one is, this one was a study conducted by scientists, at the University of Texas Health Science Center, found that the use of antibacterial mouthwash can lead to an increase in systolic pressure. Systolic blood pressure is the one that is at the top. When you measure your blood pressure, you have two numbers. The first one is the higher number, and the lesser one, the less one is called the diastolic, while the higher number is called the systolic blood pressure. They found out that the use of antibacterial mouthwash in healthy individuals actually causes the systolic blood pressure to increase. Wow, that's an eye-opener. And so, which one should we do? Should we use the mouthwash and have the risk of a stroke? Or could we just can the whole idea of using a mouthwash? And ignoring the mouthwash affect your health in a negative way. So that's what we need to review by the time we finish this discussion today. We should be able to address that, and for you to be able to go home and say, wow, I am making a definite decision. I am not using mouthwash again. And you will not have done anything wrong, and it will not be a blasphemy against those people that are manufacturing the mouthwashes, or a hate crime against them. It will be just because you are making, a conscious effort to save yourself from unnecessary health problem. Let's look at the third research that I wanted to allude to. This one was conducted by the British Heart Foundation. They found out that participants who used mouthwash twice daily had an average increase in blood pressure compared to those who did not use mouthwash. So now you have the British experiencing it in their own research, and there are research, data to support the claim that actually using mouthwash twice daily will negatively affect somebody's blood pressure. All right. So you now see these three studies that I alluded to, because they are not contradictory to the hypothesis or to the theory that using mouthwash, antibacterial mouthwash twice daily will definitely increase your blood pressure. We just want to increase the awareness of everybody who thinks their oral hygiene practices would not be complete until they use a mouthwash. And they are putting a lot of resources into buying the most expensive, the most marketed, the most, presented mouthwash to be the best. They will spend their money buying those, not knowing that they are making their health worse. So now we must make a conscious effort to alleviate this trend of getting people's blood pressure up. So you now see it's not just only those who already have high blood pressure, but even normal individuals experience an increase in the blood pressure just by using the mouthwash twice a day for a week. So now we are not saying that the mouthwash does not have any beneficial effect in maintaining oral health, but we're saying if you have a healthy mouth, but your blood pressure is going through the roof, that's not good. That's a wrong direction that the general health is moving. So now what do? I have now to recommend to you that the use of antibacterial mouthwash at least once a day or less because there was no study that says from 0 to 1 to 2 to see the effect of that. So since we don't know that using it once a day is deleterious to one's health, for those who feel they cannot do without a mouthwash, reduce it. Reduce the frequency of use. At least if you're going to use it, you can use it once in 3 days or once in 1 week if you must use it. But I can tell you as a dentist, with the kind of background that I've been through, that I have not used any manufactured mouthwash for the past 25 years. And I do not miss it. And I'm not exaggerating. I do not even use the regular toothpaste because every day the patients will come to me, doc, what's the best toothpaste to buy? I will look at them and smile. I say, do you have your toothbrush? Say, yes, I have my toothbrush. Do you change your toothbrush regularly? You say, yes. How many times do you change it a year? You don't tell me, I change it once every 6 months. Well, too late. If you change it once every 3 months, right, that means you will use a total of 4 toothbrushes in 1 year. If you use those toothbrushes by themselves, nothing else added, you will have accomplished the cleaning of your mouth the way you want it to be. But if you wanted to take it to a new level without changing the balance of the bacteria in your mouth, then all you need to do is to add common products that you add to your food, baking soda. You use it to brush your teeth. It's abrasive when it's dry, but your saliva will quickly dissolve it, so it's not going to wear your teeth down. And it is alkaline. That is, it can neutralize acid, which is being generated in your mouth by bacteria, the bad bacteria. So you adding baking soda to your brushing will not diminish the healthy bacteria in your mouth, number one. It will eliminate discriminatively the bad bacteria that are actually releasing acid, and it will neutralize the acid. And to add a kicker to it, the most of the bacteria that are very dangerous in our mouths are anaerobic. That is, they hate oxygen. They can't stand oxygen. So they go deeper to the deep gum tissue to cause havoc. So when you see people with, my gum is always bleeding. My gum, I don't know. I've been to everybody. Nobody seems to help me. I tell them, once they come to me, do you know what baking soda looks like? Yes, I know baking soda. Do you know what hydrogen peroxide looks like? They say, yeah, I know. Hey, can you do me a favor? Let's try it for 2 weeks and come back. Do you know There is nobody that I've done that to, that have come back to me and say, no, I'm not using baking soda and hydrogen peroxide anymore. My mouth is worse. I've never seen one. And so tonight, if you don't get anything from what I've said tonight, if you've been spending a lot of money on mouthwashes, don't go shopping for mouthwashes. Use what you have. Your toothbrush. If you must use toothpaste, I don't see any benefit in using toothpaste. People say, it has fluoride. It has this. It has that. It's okay. If you think that will help you, go ahead. I don't think they will help you, because in most cases, sugar is added. Sweetener is added to that toothpaste. What do bacteria love to eat the most? So now on one end, you are giving something, say, yeah, we're controlling bacteria. Then we give you food for the bacteria. So you keep on, this vicious cycle continues. That's my opinion, though. And I stand by my opinion. So, and I don't care where you quote me, but I'm just saying to you, for me, I've been using hydrogen peroxide and baking soda for the past 15 to 20 years. I've not used Colgate. I've not used Pepsodent. I've not used any other toothpaste. Just that. And I don't have anything in my mouth. No gum issue, no cavity issue, nothing. My breath stays fresh all day. Once I brush once a day. So my point to you is this. If you think you can't do without mouthwash, okay. Reduce it. Reduce the quantity, the time, the frequency of use. All right? If you know you can quit it, but you don't trust me enough to try baking soda and hydrogen peroxide, just do it for 1 week. You don't have anything to lose. Both of them together cannot cost you $4. But if you want to buy expensive toothpaste, I think average toothpaste now is costing close to $7. So you can decide, weigh it, try it, and you can use 1 box of baking soda for a whole year if you keep it sealed. 1 box for a whole year costs you less than $2 to buy that one. Hydrogen peroxide, if you expose it to light, is going to become degraded. So the plastic bottle or the glass bottle is opaque to light. So that's the only danger for having hydrogen peroxide. If you expose it to bright light, it won't have the same effect as if it's in light resistant or opaque containers that doesn't allow light to go through. So what's it in my summary? I would say that this is not a guesswork. This is not something that somebody hates the manufacturer of, Listerine or Scope or these other brands, that they want to fight them. No, it has nothing to do with that. It has to do with science. It has to do with beneficial science that shows that there are untoward, unintended consequences to doing something that we think is right. Because if we knew it's bad, we would not be doing it. And because we thought it was good, then we're doing it. So my summary is that let's evaluate our use of the mouthwashes that they say controls bacteria. Of course they do. And that's the reason why they're doing it so well that we don't want you to do it so well. We want, if there's any mouthwash that can be proven that is discriminating between bad bacteria and good bacteria, and only kills the bad bacteria and leaves the good bacteria in place, I will say to you, it is the peroxide, hydrogen peroxide. Hydrogen peroxide would do that. All the good bacteria, they love oxygen. Hydrogen peroxide releases oxygen. every bacterium that does not love oxygen, as soon as they get hydrogen peroxide in their presence, oxygen causes them to die. So you don't even need antibiotics, you don't need nothing. Oxygen just being present would destroy those bacteria that are causing havoc in the mouth. So I hope I make it clear that I'm open to questions and we will
Thank you so much.
dialogue if you have any additional questions. So thank you.
Thank you
For your
very
attention.
much. Thank you. I want to put out a reminder that on Medical Mondays with Dr. O, we are not establishing patient or physician-patient interaction or relationship. We are dialoguing on what is best for our health, how to prevent disease entities, and just living a healthy lifestyle. So, Dr. Ajagbe, you said, these mouthwashes have hexidine, cetylpyridinium, and alcohol.
Pyridinium, yes, and alcohol.
Alcohol. You also mentioned mint in the beginning. Because mint, we know that peppermints, like in tea, helps vascular issues. It helps good flow of blood, in peppermint tea. That's why, it's recommended a lot by, doctors, naturopaths, and all of that. But you said something about mint. So mint also is not good in mouthwashes?
No, nope, that's not what I said. What I said is people use mouthwashes for different reasons. To freshen their breath. The primary reason most people use mouthwashes is because of the freshness of their breath.
Yes.
Okay. And most of the time it's mint that is put in those mouthwashes to give the fresh feeling.
Got you.
Now, the mint itself is not the danger because the mint does not kill the beneficial bacteria.
Got you. Got you.
So
I understand
it is
now.
not. Okay.
I understand it. I got that.
So it is not the mint itself is not a problem.
Okay, I got you. Also, reminder, if you have questions, you can raise your hand. You get the opportunity to ask it faster, or you can put it in the chat box and I'll read it out. I have one more question before I go to the chat box, unless somebody raises their hands. Baking soda. You've talked to us about using baking soda and hydrogen peroxide to brush our teeth. You use it yourself. We've been around you in many social gatherings and you do not have bad breath. So we know that it works. You said, though, that we need to seal the baking soda, that if you keep it, then,
exposed,
it can last you for like a year. What do you mean seal? So, because I have baking soda on my kitchen counter, on my sink. 1 minute, sir.
Okay.
I have baking soda. It's still in the box. And all I do is just pour a little on my hand. So if there's because I don't like to dip my toothbrush into the baking soda, and then I feel like I'm contaminating it. So if you can please guide us as to how we should seal the baking soda and how to use it in a easier fashion, that'd be great.
Good. Excellent question. All right. So it's simple. If you must take it from the box, what you do is open the box where they have the perforated lines, puncture that, and open it gently. All right? Don't tear off the whole top of the box. Just open it so like you want to pour a little at a time. That's fantastic. But what you now do is get a Ziploc bag, like a sandwich bag. If you're not going to take the baking soda out of the box and you want to use it from the box each time you want to use it, so you seal it inside a Ziploc bag. Whether it is a small sandwich bag or a gallon bag, it doesn't matter, as long as it's not exposed to the air. If it is exposed to the air, it absorbs moisture from the air. It absorbs odor from the air. So that is why you put it in your refrigerator. When you open, there's a baking soda package that is made for refrigerator. It's open on both sides of the box, but it has a mesh that allows air to go through across. As the air goes through, the moisture and the odor from inside your fridge is captured by that box of baking soda. So that's why it is used for deodorizing the refrigerator. And it also takes moisture.
That is different from the one we use to brush. The regular one is what we buy.
It's the same product,
Yeah,
but
no.
used for different purposes. So let's say that's all you have.
Just for clarity and to help our people, that's not all we have. We want to stick with the one that is not the refrigerator brand that you just open, and I get what you say, but put it in Ziploc bag afterwards.
Yes, the point of sealing it is to prevent moisture and odor to be absorbed by the one you want to use to clean your mouth.
Got you. Thank you. So, Dr. Ajagbe,
that's
on mute.
Hold on 1 second. Hold on 1 second. Hold on 1 second. And then another way to do that, because baking soda is not photosensitive. That is, the light doesn't make it go bad. Yeah. So you can get a container with cover, a jar with cover, or mason jar, whatever container that you can use, that you can cover after each use. You can put a small scoop inside it, like a small, almost like an ice cream stick, to take enough amount to put on your palm and use your toothbrush to pick it from there. So you are asking me to give you options of how to keep it in airtight. Basically, that's what I'm saying.
Okay. So what I got from what you said, we can leave the box like that, put it in Ziploc bag to zip it. Or
exactly, that's what I do.
Or dump it into a container, like a bottle or something, and put something to for each use.
Exactly.
Back.
Exactly.
Thank you so very much. Got that. So,
you're welcome.
Dr. Ajibade, we have lots of questions. Kindly, good, you're muted. Kindly ask your question.
Okay, thank you, Dr. O, for always showcasing excellent presentations, and thank you, Dr. Ajagbe, for your excellent presentation. I came a little late, so I have two questions. One is, I didn't catch you saying anything about this. If you did, I apologize. But did you say anything about nitric oxide and mouthwash? You did? Okay,
yes.
Great. If you don't mind.
That's what we just talked about.
Okay, great.
Dr. Ajagbe, can you please summarize in a couple of sentences what you said about nitric oxide?
My second question too, just so we can just answer them, both of them. Second question is that I've heard dentists say over and over again that they're stressed that you must brush your teeth twice a day, in the morning and in the evening, and some are even emphasizing the evening more than the morning. But I just heard you say that you only brush once a day. Is there any strategic? Did I get that wrong, or is there any strategic reason for that? So those two questions.
Oh, well, okay. Thank you. So the nitric oxide, aspect of using the mouthwash is the crux of the discussion today. So the mouthwash, particularly the antibacterial mouthwash or mouthwashes, prevents the conversion of nitrate to nitrites, from nitrites to nitric oxide. The key is between nitrite and the nitric oxide. That link is facilitated by the bacteria, the good bacteria in the mouth. So if you reduce the population by using the antibacterial mouthwash, which does not discriminate, it doesn't discriminate between good and bad oral microbiome. What it does is just kills as many bacteria as possible. So the good bacteria that actually are necessary for the conversion of nitrites to nitric oxide, which will cause the relaxation of the blood vessels, will be reduced. So once there's a reduction in the formation of nitric oxide, the blood vessels are not as flexible as they should be, and so the blood pressure increases. So I share 3 research studies. One, that was published in the
yeah. So Dr. Ajagbe, we won't go through the research studies, but just the night.
Okay, so he said he missed it. So let me.
It's all right.
So the second question. So the second question is, can you remind me about the second question then?
He wants to know if
the baking soda. The brushing once a day.
Yes. Are you advocating brushing once a day, or what?
No, I said that's what I do. I didn't say that's what the recommendations are. I said that's what I do. I do that based on my own experience. It is not based on any empirical study. Do you understand? So for anything that you want to put out there, if you want to do it based on evidence, then you have to have data to support that. So I cannot say that in presentations like this. I can only tell you what my own anecdote is, my own experience. So I hope that answers your question.
Yes, thank you.
Thank you.
Thank you.
Dr. Ezugu and Dr. Anekwe, don't you think that it's only doctors on this platform? We have every profession. It's just the doctors raising their hands.
Dr. Ajagbe, thank you so much for that presentation. That's really beautiful. The area of hypertension is a big issue. So what you're saying is absolutely true. We've seen patients who, they have high blood pressure, and then they come in, their pressure is not being controlled, even though it's been controlled for a while. And really, when you dig into the question, you may find it's a mouthwash. Sometimes it may even be a cream. Sometimes it may even be just something else they are eating, so that's a real factor. And really, when you pick that up, you can say, remove that and, do something else or use something else. What you recommended with the baking soda and peroxide, those are really very, very good to keep the bacteria out of the mouth. We do really emphasize that, killing those bacteria are important to prevent what we call endocarditis, which is, again, infection that go from the mouth to the heart. So invariably, if we are one of those that really need that, because once we examine you and we look into your mouth, even if you have to use it once every 3 days to clean keep the mouth clean, we do that. And sometimes even if we have to adjust your medication to control the pressure, we may have to do that, but it's a real thing. And you can easily detect it by yourself as you check your blood pressure on a daily basis that something have changed, So even when you notice that with anything else besides mouthwash, bring it up for discussion with your doctor. I'm now applying a new hair shampoo. All these things is absorbed by your body into your system and can create high blood pressure sometimes. Thank you.
Thank you so much.
You're welcome.
Dr. Ezugu is a cardiologist, so we are so blessed because we have a wealth of knowledge. Thank you. This is an eye-opener for me because I do use mouthwash. And it's alcohol-free. We've discussed this on Medical Mondays. You said use alcohol-free. Now tonight, we're finding out, leave it alone. Thank you. Dr. Anekwe.
Yes.
Anekwe.
Dr. Anekwe.
Yes, thank you, Dr. O, and thank you so much, Dr. Ajagbe.
like Dr. O pointed out, this is really an eye-opener. In fact, it's more than an eye-opener. So I am at my mom's place now, and then as you were talking, I have to go bring all her mouth stuff, you know,
That's
because
good.
to be honest with you, I am really, really alarmed right now, okay, because she has high blood pressure.
Oh, wow.
We are battling to keep it down, not knowing that we are also exacerbating it in an attempt to help other stuff, right? We want her mouth to be fresh, but we're also killing her, right? So I went and checked,
Yes.
wondering if there might have been a black box warning somewhere that, whereas Listerine can freshen your mouth, but it may also raise your blood pressure. So the question, why doesn't it have such a black box warning? And then two, her toothpaste, like you rightly pointed out, and I must confess that I thought I had things under control, not knowing that the toothpaste also has sweeteners and sugar. And I have tried my best to completely eliminate sugar from our diet, but not knowing that I'm not even doing an excellent job as I thought, because you're right. This has sugar, it has sweeteners in it. And whereas this is trying to take care of her oral hygiene, but it's also giving her sugar, which is also dangerous for the teeth. So again, why doesn't all these things have a black box one in it? It seems like they are feeding into the conspiracy theory that these pharmaceutical industries and should I say healthcare products too, they are also complacent in hurting the average people.
Well, I don't want to say anything like cutting into anybody's philosophy of doing things. But to me, it looks like until there are regulatory things in place to actually put the checks and balance in the manufacture of any product whatsoever. So there are bodies of data supporting the individual effectiveness of each additive component. Do you understand? So they say cetylperidium, what does it do? Somebody did the series of experiments and say, this thing is working very well. You know, the thing about it is telling the manufacturers, this thing is killing people. They will want you to change your narrative by saying, well, the studies are not conclusive, the studies are still ongoing, so let's not jump to conclusion. So you understand what I'm saying now, right? Yeah. So, and if they have lobbyists that are being paid to make sure that no regulations and no legislations are going to be against their ability to make the profit that they want to make, you will not get anything like you are asking for. There will be no black box labeling. There will be no white box labeling. There will be nothing. You hear me? It's only people who are interested who would say to you, I see this article. How could it be? And then you see that these are real, clinical trials that were conducted in a very empirical way that is not biased, that is giving you data to say this thing is dangerous for your health.
Yeah.
Even the tobacco, think about tobacco. Tobacco carries Surgeon General's warning. Are they still not selling it? Are they not selling to minor? They sell it to minor. So what do you think about mouthwash? They'll tell you mouthwash makes my mouth fresh. I can't do without mouthwash. So of course, marketing is a big thing.
Yeah. Sorry, just one last question. Did I hear you say that almost all, if not all of them, are dangerous? Because I can tell you that a few years back, I went to see my dentist and they were asking me the type of toothpaste that I was using. I said that we use a Crest toothpaste. And the dentist told me to throw away anything that is not Sensodyne. She said, don't use any of these toothpaste because they're all cheap and they hurt your dental health. But of course, I went home and then my family fought me that no way will I get rid of their crest. So for years now, I use Sensodyne and they use crest. In fact, they tell me to also use crest in addition to my Sensodyne. But I just keep crest just to deceive them I'm also using it, but I don't. So is there really any safe toothpaste out there?
I remembered over 15 years ago when Dr. Ajagbe was advocating Sensodyne. Remember, even when we go to do health fairs, we were giving away Sensodyne toothpaste. So thank you so much for that question, Dr. Ajagbe. Stop it.
All right, so Sensodyne was not designed originally for cleaning teeth. Sensodyne was actually produced to contain a higher level of fluoride to prevent sensitivity or to address sensitivity of teeth. Sensitivity occurs once you already had gum disease, or you have what we call parafunctional habits like clenching and grinding your teeth that causes you to lose gum tissue. You lose gum tissue after you've lost the supporting bone underneath. And so the gum follows the bone that is melting away. Once your bone shrinks and your gum shrinks, your root, the root of your teeth will be exposed. So the exposure of those root surfaces is what causes the sensitivity that many people have. So Sensodyne contains the chemicals that actually minimizes the sensitivity. So you see that the original intent for Sensodyne was not for brushing on a regular basis. You understand?
Wow.
So when they looked at the market, they look at the trend in the market. Every toothpaste is making gains. Every toothpaste is doing very well. Sensodyne was not doing well. Sensodyne was being prescribed by dentists only. And only dentists that believe in it will prescribe it. So you see, it's cutting them off of the piece of the pie that they needed. So now they had to reinvent themselves. Now they make toothpaste that is Sensodyne.
Okay.
That it does no longer need prescription.
Right.
Initially, we are the dentists that would tell you to buy Sensodyne. You didn't know about it in the market. If your dentist didn't tell you about Sensodyne, you didn't know it existed. But now they are selling toothpaste that are Sensodynes. So you see, it's about marketing, it's about market share. So you have to bear that in mind. That's my opinion. Remember? That's my disclaimer. I don't have anything against manufacturers. I don't have any investment rights in baking soda or hydrogen peroxide. I don't have any of those. So I'm not trying to move people away to my own selfish, corner. So I'm just saying, based on my own anecdotes, experience. Okay. I'm not saying this is research. I'm saying this is my own experience for over 15 years that I've been using only baking soda and hydrogen peroxide. That's all.
And I can say, as his primary care physician, it may get me later, it does not have high blood pressure, if I may say. So, that being said, there is research, though, Dr. Ajagbe, that has shown that mouthwashes increase blood pressure. You've shared 3 with us.
Yes.
So we remember that.
Right.
So no research on baking soda and hydrogen peroxide. You've used it. You've told us this over and over again on Medical Mondays and encouraged us to switch. So, and it works. We know that. So we get it. I think we get it to change our lifestyles.
So I just want to tell Dr. Anekwe, you can encourage your mom to try the baking soda and hydrogen peroxide.
Yeah.
When she brushes her teeth and her tongue with the baking soda first, and then rinses with the the hydrogen peroxide,
Yeah.
it will foam in her mouth.
Right. Yeah. It
When
does
she
form.
spits out, when she spits out the foam, she can now rinse with just plain water.
Yeah.
Just that ritual, if you call it that, will make the mouth fresh.
Awesome. Oh,
And
yeah.
all the aftertaste you get from eating baked goods and coffee with sugar and cream and all of that will be minimized after you've used the baking soda and hydrogen peroxide to brush your teeth and your tongue.
Awesome. This is wonderful. Thank you so very much. I am all over this. I am not leaving her house until I get rid of all of this and go searching for baking soda and hydrogen peroxide.
And the
Yeah.
hydrogen peroxide comes in containers that are dark, so
Right.
protected from light.
Yeah.
So I just squirt it like that straight into my mouth. I squirt it,
That's the way it is.
and I close
Okay.
it. Yeah.
Okay.
That's the way it is. You just squirt it into your mouth, and that's it.
So you don't have to dilute it with water. You just use it like that straight out of the bottle?
Just straight ahead. Yeah.
Nope.
No, you don't dilute it.
Okay.
Okay. Let me quickly address that.
Percentage. Dr. Zugu asked what
Yes.
percentage of hydrogen peroxide.
That's what I want to tell you.
Yeah.
I want to tell you that if you get 6%, you should dilute it.
Oh, okay.
Don't use 6% hydrogen peroxide neat. It will burn you.
Okay.
3% hydrogen peroxide solution is safe in your mouth.
And most of them come as 3%.
I see.
I'm just saying.
The 6% is.
I'm just saying. So
the 6% is.
Yeah, 6% is too strong for anybody. So I will not use 6% straight.
Okay. I see, Gary. Thank you so much.
Thank you. So Dr. Ethel, Dr. Ethel, that's another dentist in the house. Dr. Ethel, kindly unmute.
Please. I just said good evening, Dr. Ajagbe. Excellent presentation.
Yes.
I just wanted to add a little couple of endorsements. The hydrogen peroxide, excellent. You dealt with it beautifully. The brushing of once a day, I agree that if that's your disclaimer, that's excellent, but patients don't brush efficiently like you and I, who are dental professionals. So if you don't mind and help me, and let's encourage them twice a day, because most people brush for 5 seconds or less. So that part will be more decay prone if they don't get the food, the bacteria, the germs out of their mouth. We're going to have periodontal gum disease, we're going to have decay and halitosis. That's my comment to add. So appreciate you. Thank you.
Thank you
Thank
so
you, Dr.
much.
Ethel.
You're welcome.
She's another doctor dentist in the house. And you know what? I tend to agree with it twice a day, because when you wake up, you brush your teeth. But at night, you want to brush off all those foods and the bad bacteria also, because when you're not talking, it's when they have a field day. You're not talking, you're sleeping. They have a field day to do their dirty job. So it's important to brush at night. So I'm with you, Dr. Ethel. And Dr. Ajagbe brushes, very well. I think in the morning, right? Or at night is when we brush.
Yes, I brush primarily in the morning. And the reason for that is simple. When you sleep, you don't swallow. You don't have the continuous flow of saliva unless you are drooling on your pillows. If you're not drooling on your pillow, that means your mouth stays in an aerobic state. So if you use toothpaste regularly and you brush last thing at night, you still have some sugar left in your mouth, and your brushing does not kill the bacteria. So there will be still some bacterial activity going on. So what we are saying today is to maintain a balance, that as we get rid of the bad bacteria, whether it is brushing twice a day, if that will help us to get rid of the bad bacteria and preserve the beneficial bacteria, then we are moving in the right direction. If we brush 4 times and we are shifting, no, I'm just using that as an exaggeration because some people do that. They actually brush more than twice a day. So if you take it to the extreme and say, well, I really want to get rid of all these bad bacteria in my mouth, well, if you are doing things that are actually not just eliminating the bad bacteria, but eliminating the good bacteria as well, then we need to address that. Slow down and, just give the healthy bacteria room to grow as well. I still recommend to my patients to use, to brush twice a day because like Dr. Ethel said, they may not be brushing effectively the way they should because anytime you brush your teeth and after a week you see something between your teeth, that means your brushing has not been effective. I don't care how many times you say you brush every day. And that's why I tell my patients when I see them, I say, oh, how are you doing with home care? Oh, I brush 2 times a day. I said, well, thank you for telling me that, but my examination will prove what you've been doing. And then I would take the mirror, if I don't use an intraoral camera, I use a mirror and say, let's take a look at your teeth together. And I scrape it, I show them, you see what is coming from it. Them if there's anything gathering along the gum line, and so they know. Even some of them will say, I just brushed before coming, and I say, well, let's check it out. And we check it out just in a fun way, and they say, oh my gosh, I still have that much on my teeth? I say, yeah, that's, if your brush remove them, you won't have them there. So please, as a dentist, I would still recommend twice a day because I know that brushing efficacy varies from individual to individual. And that seems to have worked in the past for many people. Maybe it still didn't work for a lot of people. So twice a week, to go back to Dr. Ajibade, you can still brush twice a week. Twice a day, rather, not twice a week. Please scratch twice a week or twice a day is what I'm saying. Okay. So twice a day you can brush.
We'll go to the next person. So you don't stumble on this twice a day and twice a week anymore.
Yeah.
Dr. Maureen,
yeah, let's go.
Kindly unmute and ask a question. See, that's
Yeah.
what I said. Answer a question straight. We have a lot of questions. See?
Yeah. Good evening. Nice to be back. 2 things. The mouthwash, are they using it diluted or undiluted? And secondly, I've actually seen a patient, young person, and the ENT said mouthwash sometimes gives oral cancer. Have you ever heard of that? She was in her 20s and she had cancer, something in the mouth, and they said it was due to mouthwash. Please enlighten me.
Well, alcohol is one thing that has been linked to oral cancer. Not everybody that drinks alcohol gets oral cancer, but not all oral cancers are caused by alcohol. But there has been a connection between the use of alcohol and oral cancer. Now, for somebody who the only culprit is mouthwash, I cannot tell you categorically that will be the only etiological factor that is a causative factor. So if it's one case, I can't say it didn't exist. At the same time, I can't say that's a norm for the oral cancer cases. So it would be nice to see, a body of literature to support that. And we can talk about that at another time or just a question raised later on. I'll find out the information and share with us.
Thank you so much, Dr. Ajagbe.
But you didn't say if the mouthwash is usually diluted or or
okay, so
rinse.
okay, so the problem with diluting the mouthwash is what effect do you want to have? Remember, any of these things before they release this into the market, they would do what they call minimum inhibitory concentration. And that's the way they do it in the lab. They will find the concentration of the mouthwash that can actually inhibit growth of the bacteria. So let's say they said Porphyromonas gingivalis is a primary target, and they plate it out on agar plates, and they apply they will now use different concentrations of the mouthwash to see which one gives inhibitory effect on the growth of the Porphyromonas gingivalis. So now when they see that, they will say, okay, if you diluted it 50-50 with water at this level, we don't get any inhibition. So that will not be useful for what they want it to be. So you understand? So now if you diluted it, let's say they say the concentration is 3%. And the 3%, now you dilute it to maybe 10%. If it's 3%, now you take it down to 0.01%. Then you find out there is no effect. So you might as well just be using plain water to accomplish the rinse that you're trying to get. Now, you may still have some mint there. Mint will give you freshness of the breath, but the controlling of the Porphyromonas gingivalis is not going to happen. So most people do not dilute their mouthwashes when they use it. They use it straight the way the manufacturers tell them to use. If they say 1 cup full, they use 1 cup full.
Thank you. Yeah, I've never seen anyone dilute mouthwashes. They don't. But even if it's diluted, it doesn't take away from the core ingredients. And I think it will still do the same thing.
Mm-hmm.
Oh, Dr. Ajibade, kindly unmute and ask your question.
Okay, thank you, Dr. O. Dr. Ajagbe, I noticed, again, I apologize if you have said this before, but I didn't hear anything said about, I haven't heard anything said about flossing. Is that something that you discourage? That's one question. The other question is, most dentists in the US, they tend to recommend soft or medium toothbrushes. And quite frankly, I think for we Black people, the soft one does not do anything for me at all. I think one of the few advantages I've noticed we have over the whites is that we tend to have stronger bones, less osteoporosis, and also stronger teeth. That's just an observation. You being the expert, is there something? What are your observations? What are your general observations when it comes to taking care of white people's teeth as opposed to Black people's teeth? Those are the two questions. Thanks.
All right. Well, since the focus of tonight's presentation was on the unintended deleterious effect of mouthwash, which is increasing the blood pressure, we didn't talk primarily on, oral hygiene as a whole, but the question you raised about flossing is not precluded in this presentation. Flossing is still important. So you still need to brush and floss, okay? So I hope that answers that question. The second question about the strength of your toothbrush. Dr. Ajibade, I've shared here also a few times that you can actually use your washcloth to clean your teeth. Do you understand that? So
yes.
if you can use your washcloth, wait, Dr. Ajibade, you see where I'm going with this. If you can use your washcloth to clean your teeth, which is not as abrasive as even the softest toothbrush, right? Because this end of the bristles is supposed to agitate soft plaque. Remember? What we are trying to do, if you do it daily, you should never have thick plaque on your teeth. But if you have not done it and there is increased thickness over time, soft toothbrush will not do any good to thick plaque that has accumulated, that's on its way to becoming calcified. So when you have not flossed for a week and you have brushed very minimally because you're in a rush in the morning, or when you want to go to bed early, and you do all of this and you didn't do an effective job, you will have this plaque accumulation and you will have tartar buildup over time. It's just a matter of time. You will see it. It will be obvious. Your tongue will find it first. My guideline to people brushing effectively is feel your teeth before you start brushing with your tongue. Your tongue is the most sensitive part of your body. It will find the finest layer of pellicle on your teeth. So if your tongue detects something on your teeth and you brush and you still feel it, that means you're brushing that day. That moment is not effective. That means you have not removed everything that you need to. Go back to that area, make effort to agitate it, because your toothbrushing is agitation. Mechanically, you are removing the plaque. And that is the best way to remove plaque, by mechanical agitation and brushing it off and rinsing it off. So to say that the Black people and the white people, I think Porphyromonas gingivalis is an equal opportunity offender. It will affect anybody regardless of the race, even age. So, and it doesn't obey the rule of gender. So it's equal opportunity. However, because mindset is also one thing, definitely a hard toothbrush will seem more effective than a softer toothbrush if you have thick plaque or a calculus that is already building up. It's already hardened, but it's not very hard yet. So I would not go by race to say only the Black people should be using, hard toothbrushes. Yeah, if you use your medium toothbrush properly, if you use soft toothbrush properly, you will get the intended outcome, which is to have clean teeth, clean gum, clean tongue, and healthy mouth. Thank you.
Okay, thank you, Dr. Ajagbe.
Thank you so much for that answer. Dr. Ajibade, don't worry. A lot of us were in that boat before. I fought him over hard toothbrush. He also brushes off your enamel. He didn't say that when you use it, especially when you don't need it. So the soft toothbrush.
Well, abrasion is what we're talking about. Anything that is very harsh on your tooth surface will take layers of enamel off of your teeth. So for instance, some people...
Sorry. So Dr. Ajagbe, are you really saying that there is no difference in your many decades of practice between a white person's dentition and a Black person's dentition?
It will not be a racial thing. It will just be because of their individual ability to care for their teeth. So if a Black person is not schooled on how to use the toothbrush well, I don't care the strength of the toothbrush they use, they will still have gum disease, they will still lose their teeth prematurely, they will still have plaque accumulation and staining of their teeth. You understand? Now, if a white person understands how to use a soft toothbrush very well, and they are very meticulous in their brushing, they will not have any plaque. So they will not have any tartar buildup.
So it just comes down to use, understanding how to use. Okay, all right. Thank you, sir.
So, and that's the reason I said you can use your washcloth to even clean your teeth. So if the washcloth is softer than the toothbrushes, So why can't a soft toothbrush clean your teeth? I use soft toothbrush now, not because it's just that I've seen that it does the same work as a medium or as a hard one. And it's just a personal preference. Now it's not because it's more effective or less effective that I'm using it.
I'll get to the chat box. We have lots of people raising their hands. Dr. Ethel, please go ahead and ask your question. Again, if you raise your hand, you will get your question answered earlier or sooner.
I'm just going to add to the answer for the brushing technique that Dr. Ajagbe told the other doctor the question. Technique is extremely important. We do not encourage the hard toothbrush. Very true, like Dr. Ajagbe said, because enamel will be worn off your teeth and cause you a sensitivity problem that you may require either sensitive toothpaste Sensodyne or restrictive work to cover the sensitive areas that may be chronic. But technique means don't rush the brushing. The circle motion your dentist or hygienist teaches you is critical. And for the second part of your question was the ratio. I agree with Dr. Ajagbe, that it does not make a difference. It's if you're doing your good home care, your racial background does not, we don't see that in the field of dentistry to impact our patient care. So Dr. Ajagbe was correct on that. Thank you.
Thank you so much. Thanks for that contribution. There's only one Dr. O. So please tell me what your name is when you're on mute and ask your question. There's only one Dr. O, and that is Moa.
This is Dr. Oguleye.
She's my baby, oh.
The non-medical doctor.
Okay, no, you could be non-medical Dr. O, but you're my baby. You're the only one allowed to be Dr. O.
Yes, so I just wanted to ask Dr. Ajagbe, isn't hard brush also deleterious on the gum? Doesn't it strip the gum and expose the sensitive parts?
Well, yeah, like Dr. Ethel said, technique is the key. One of the things I tell patients is this: I don't care how much money you want to invest on a toothbrush. If you don't use it properly, you're going to cause more problem than solve problems. Yes, if you use even the soft toothbrush the wrong way, you can still cause gum recession. That's what we talk. That's when the gum moves away from the teeth towards the root apex. And so if toothbrushing, ineffective toothbrushing can cause that. Hard toothbrush may make it worse faster than a soft brush. So technique is the key. If you're not using anything properly, you'll cause more problem. Now, I know the time is coming, the end of year is coming, and people are thinking of, wow, when am I going to buy my special person for Christmas? And they are thinking they have bad breath, their teeth look funky, and you want to buy them rotary brushes. You want to invest on Sonicare. You want to invest on so many expensive toothbrushes. I just want to warn you ahead that you can spend a lot of money buying those things. If they don't use it properly, you're still going to cause more problem. Because now you have motorized and powered toothbrush that is more vigorous than your own normal brushing. So you got a problem with that. So I just wanted to throw out that to you as a group, that you know that technique is very important, and not the amount of money you spent in buying what that you want to use. You must know how to use it properly.
Thanks, Dr. O. That's our Dr. O in California. And I'll ask you to unmute again. Unmute and ask your question.
Oh, Dr. I already asked. It's done. Thank you.
Oh, okay. I saw your hand up again. Okay.
I thought I put it down. Sorry.
Okay, got it. So I Ifonola said that they use cloves soaked in water or a little bit of salt in warm water. Any feedback about that? Cloves soaked in water or a little bit of salt in warm water to brush. Any comment on that, sir?
Well, cloves does not destroy healthy oral bacteria. Cloves has anti-inflammatory property. So we use cloves, we use oil of cloves to actually control toothache. So if you have cloves and you are brushing normally with it and you have very good technique, you should have a very healthy mouth. You shouldn't have a lot of inflamed gum, that we call gingivitis and all of those stuff. Because clove has a medicinal effect in your mouth. And cloves will also give you very clean breath.
Okay, so thank you, Dr. Ajagbe. I'm going to ask this question right after that because it goes together from Dr. O in California. She says she mixes neem powder, baking soda, clove powder, activated charcoal, and ashes to brush her teeth daily. Then about once a week, she adds a little bit of hydrogen peroxide to our water floss. She hasn't had any issues with her teeth or gum.
Well, thank you for sharing that. All of the mixtures that she's using, they are healthy for the mouth. We've talked about baking soda. Yeah. We've talked about the cloves at a different...
Neem powder also.
Yeah, I understand. She still added some cloves to it. She adds neem. Yeah, so neem is another plant-based powder. It's the same thing that we call dogoyaro in Nigeria. It's the same plant, the leaves. It's anti-malaria, and it has an abrasive effect on the teeth when you mix it with baking soda and other powders. So neem on its own may actually be antioxidant. It has antioxidant property, which means if there's any free radicals in the mouth from any kind of exposure, neem will neutralize that to some extent. Hydrogen peroxide once a week is a good addition. But I must tell Dr. Ogunleye that the reason you are having healthy mouth primarily is because you have an effective technique, not the powders that you are mixing together. Those are secondary effects that you're going to get. If you use those, but the plaque still remains on your teeth, and you still have plaque going down the gum line, below the gum line, and it's causing deep issues, the only thing that will be effective in that case will be the hydrogen peroxide that releases oxygen in the depth of the gum tissue. So you are using a good technique. You are using what I can call alternative to manufacture dentifrices, like toothpaste, like other things that other people buy to brush their teeth. Another thing I would say about activated charcoal. Activated charcoal, we talked about it, is a form of it's a chemical that does absorption of poisons. We call it chelating agent. So it's also good, in neutralizing any kind of poison that might be released either from bacteria or any other source in the mouth. So the mixture is good, but Like I said, you can use your toothbrush and get the same effect without anything. You can use toothbrush alone without anything and still get the same effect if your technique is good.
That's another dimension. So I don't know. There are two questions here that I want to put together again. Marcis from Women Like Esther said, what is the proportion to mix the peroxide and baking soda? And Ifonola says, do you mix baking soda and hydrogen peroxide for use? If yes, what ratio? I think they're the same question. So if you please go over it again. But before you do that, I have another one I want to add. In the chat box, there is this picture of baking soda that was pasted. It's really cool. The container has refillable container. It's like a seasoning container that I think you can just dump, which is, I've never seen this. I'm going to look for it. I think it's, it answers all the questions that we asked before about how should we keep our baking soda from absorbing environmental moisture.
Yeah, contaminants and moisture. Yeah, that's very good. The proportion should not be a deterrent to using baking soda and hydrogen peroxide. The way I use it, let me just tell you simply the way I use it. I will wet my toothbrush before I apply maybe 1/4 teaspoon of baking soda in my palm, clean hands, and I will use my wet toothbrush to pick it up. It will become adherent to the toothbrush if the toothbrush is wet. It will pick a bunch of that. And if you want to put everything on that toothbrush, you can still do that just by simply adding the remaining on your hand on the toothbrush that's already wet with baking soda. I mentioned earlier that this, if you make that fresh, just water in your toothbrush and baking soda, the baking soda will be abrasive for few seconds. That is, when you apply it to your teeth, it seems to be more abrasive than any toothpaste you have. But it will soon dissolve in your saliva. So it's not like sand in your mouth that stays there, that keeps wearing down your teeth every time you brush. So now the baking soda, once it dissolves in your saliva, now goes to work. It will neutralize any acid content in your mouth, which actually is the reason you have sour taste in your mouth, as well as bad breath. So the sulfonic, sulfur compound that are released in the mouth will be absorbed also by the baking soda. While you are brushing your mouth and you are spitting out what causes bad breath. And you are spitting out the dissolved or dislodged plaque. And once you do that, and you now rinse your mouth, like Dr. O said, you take the bottle, it's plastic bottle and it's squeezable. You hold it to your mouth and squirt enough mouthful and just use it to rinse. Use it to rinse and gargle your throat with that. And you're done. If you want, you leave the foam in your mouth. Eventually, you'll be able to swallow it. But don't swallow the hydrogen peroxide that is in your mouth, that is a mouthful. Don't do that. Spit it out because you want to use it to rinse out anything that you just dislodge with your toothbrush. So, baking soda on the wet toothbrush, you brush first. That's what I do. I've been doing it for over 15 years. And then I use the squirted mouthful of peroxide to gargle and rinse my mouth. And then if I have too much foam, I spit it out and then use a little bit of water to rinse as well.
Thank you very much.
I hope that helps. But if you think you must mix it before you use, well, it doesn't change the composition. It just means that you get, instead of using wet toothbrush with water, you are now mixing baking soda and hydrogen peroxide together. The thing is, it's going to be foamy, and it's not going to stay together like if you use wet toothbrush to pick your baking soda first. So you are welcome to try both and see which one works best for you.
Thank you very much. So Ms. Cassandra Ewing said, thank you for this information. But she has a question. Do you have any specific or special recommendation for those who smoke, other than stop smoking? Any recommendations?
Well, there's no special recommendation. You already put there, don't tell me to quit, all right? Okay. So we will not tell you to quit, but if you just want to freshen your breath and keep plaque away from your teeth and prevent cavities, yes, the same regimen, the same baking soda, brushing and rinsing with peroxide will help. Now, if somebody smokes and they already have diabetes, they are more likely to have gum disease. And I've seen people whose diabetes are not controlled, who have had terrible gum situations, that have gone from dentist to dentist, and they have not been able to shake it. After telling them to try to use the baking soda and hydrogen peroxide for 2 weeks, they can't quit using that. So if you are smoking, the baking soda and hydrogen peroxide is your friend. Combination of them, using them, will give you fresh breath, no doubt about that, but then it's going to minimize the effect of plaque accumulation because of dry mouth, which comes from smoking, and then and also the potential to develop gum disease.
Well, I would add that stop smoking. We can go over a lot of reasons why you should stop smoking. So that would be the number one thing to do. Sister Shade said, thank you so much, Dr. Ajagbe, that this information is useful, and she believes hydrogen peroxide actually works a lot. And Kalejaye asked, is it okay to use traditional chewing stick?
Wow. Traditional chewing stick is as effective as a toothbrush if it's used properly. I've seen people that all they do is chewing stick and they still lose their teeth prematurely, despite the fact that it has medicinal and detergent benefits, like the one called Orijebu. Orijebu foams just like hydrogen peroxide. Not much has been done about the constituents, the biological constituents or, naturopathic constituents of Orijebu, which will be a good thing to do. The back of that stem or the tree can actually, if you chew that alone by itself, it foams in your mouth, not just the stick, just the cover of the skin of the tree can do that. So if you're using it effectively, just like we said, technique. If you don't use it well, you're still going to lose teeth prematurely from gum disease and cavities, because there are a lot of Nigerians with cavities and gum disease as well. Dr. O knows what happened when we did medical mission, giving extraction as part of it. Oh, man. I don't want to show some pictures on this platform. Some people will not be able to eat. That's how bad some teeth.
202 extractions a day.
Yes, I did 2,000 extractions in 1 week. Yeah.
Yeah.
So that might help Dr. Ajibade that says Africans are stronger teeth.
I know. This was right in Nigeria, in Ogun State.
Yeah, so
Yeah.
I can tell you now that it's equal opportunity offender, gum disease and cavities and all that.
So Dr. Alu asked, do you recommend using hydrogen peroxide and baking soda for brushing in children as well?
Everybody, but you don't have to. I mean, you use the size of their toothbrush to pick up the enough baking soda for them. And then you use the same thing. You don't give them squirting into their throat because they may not be able to control that. You put it in a small container. Maybe like 2 tablespoonful measure, and then that'll be like 30 cc's. They can use that to gargle and spit out. Just tell them don't swallow, don't drink it. That's it.
So thank you so much. That's a very important question. So Dr. Olutunde asked 2 questions. Number 1, what is the effectiveness of using charcoal to brush milky teeth? And the second
No,
question,
milk teeth. That's what it is. Okay.
the second question is, what is the right direction of placing a toothbrush when brushing our teeth? I love that question because I want to know too, the right technique. So, what is
Well,
the effectiveness of using charcoal in milk teeth?
milk teeth, when I was growing up as a child, one of the ways by which we cleaned our teeth as children was to use charcoal from the fireplace. Wherever it was used to cook, they use water to quench the fire, and you have some coals left, and we use that just the way it is, and you use it to brush your teeth. The reason charcoal works, if you use it the way it is, I'm not talking about the synthetic charcoal that is being sold in the supermarket in the United States. I'm talking about firewood charcoal. You can use it as a dentifrice, which means it is abrasive, but not as abrasive as using porcelain powder or any other abrasive powder that is out there. So charcoal can be used for children. You can grind it up and use whatever you want to use to apply to their teeth and use it gently. Don't scrub it until it ulcerates their gums. Because it's quite abrasive. You don't want to scrape it on the gums. You just want to concentrate on the teeth. If you use the toothbrush with a powder of charcoal, the child will not have any negative effect. I mean, it will not have negative effect on that child. So milk teeth, adult teeth, they are all able to benefit from use of charcoal. So the second question is what?
Technique. What is the right direction of placing a toothbrush when brushing our teeth?
Well, we can be legalistic about technique and still miss the point. What I tell people is, what's your goal when you brush? Because I can tell you techniques and you don't keep to that technique. You tell me you are doing it, but I'm watching you and you are not doing it. So let me ask you, what is the goal of your brushing? You want to remove plaque from your teeth. And if you've been doing it regularly, the plaque will just be half day worth of plaque if you're brushing twice a day. You see what I'm saying? So the point is this: I liken plaque to the cheesecake. You know, like when you are eating cheesecake, whatever smears on the plate, all right? If you finish your cheesecake and you want to wash your plate immediately, you don't need anything harsh to clean that cheesecake remnants from your plate. So you can use anything soft to remove it. The technique now of cleaning your plate could be circular or could be just wiping horizontally and rinsing down. But the goal is you are removing that smear of cheesecake from your plate. And you're going to rinse it. Once you see that it's clean, you are happy. The same thing with your teeth. The teeth are like ceramic plates. If you have thin layer of plaque on your teeth and you use your toothbrush in a vertical way, that is, you hold your toothbrush first parallel to your teeth, and then you sweep it up and down like that, which means you are able to get everything on the tooth surface, including the spaces between the teeth. You can do that. And also, circular motion has been found to also be helpful if you're able to do it properly. You can do it in such a way. The goal is this: look or feel with your tongue your surface, the two surfaces before you brush. Feel it after you finish brushing. If it remains the same, you know you haven't removed anything from that tooth. Then you would know some areas of your mouth will be so smooth. Your teeth will be so smooth, you know it's clean. And anywhere else that doesn't feel like that, you know it's not clean. So you go back to those places and brush again. So that will be my overall way of looking at what technique. The goal is get rid of the plaque. And if you already have tartar buildup, you feel between your front teeth and there are rough stuff there, your toothbrushing will not take it off. I can assure you that if it's already hard. Technique is not going to save you at that point. You have to go and get it scraped off. And that's where you have your appointment. So technique, you can do vertical, you can do horizontal, you can do circular, as long as you get rid of the plaque.
But how far to the gum do you go if you go in a horizontal or even circular? Even horizontal,
you are focusing on the teeth. Primarily, you're focusing on the teeth. So let's use my fingers and my fingernails as representing the teeth. All right, my nails are the teeth, and my skin are the gums.
Okay.
Right? See how my teeth are lined up. You're looking at my fingers, right?
Yes.
I'm concentrating primarily on these teeth because that's where most of the plaque will accumulate. Right? So that's my primary goal. But there is no way plaque will form on my teeth that will not form on my gums. They may not be exactly the same amount. So my brushing will still go to that whole area when I'm brushing. But I'm not going to go in a very forceful way to remove the plaque. Remember the analogy. If it's just like you finish eating your cheesecake and you immediately want to clean your plate, you don't need much force. But if you ate a bar or you ate something that can become crusty and you leave it for 2 days and it dries up, you cannot just do a simple wash of that plate. You have to soak it. You have to do something extra to remove that leftover on that plate. The same thing with having tartar buildup in the mouth. If you have tartar buildup on your teeth, simple technique will not remove it. You need help. So technique, go as far onto the teeth as much as you can. Remove the primary collection of plaque. Then go around your gum gently along, both in front and inside, and remove as much as well as go to your tongue and brush your tongue.
Thank you so much, sir. I have another question, a follow-up question, still from Dr. Olutunde. It says his own impression about hydrogen peroxide was that it might be one of those factors that contributes to milk teeth. Is this true or false, sir?
Milk teeth? Okay. I'm assuming, okay, I think I misunderstood what the questioner was asking.
I said it initially, but it thinks
Yeah, when I saw milky teeth, I thought it was a typo, which meant milk teeth we call baby teeth. The deciduous teeth, the one, up to adolescent, when all the teeth are exchanged, the baby teeth are replaced by adult teeth. I thought that was what the question was about. Now, if it's, I would rather that he explains what milky teeth, what he meant by milky teeth, because right now I don't want to misunderstand.
Dr. Lutunde, kindly unmute and explain that.
Okay, I see the comment. He says he meant discoloration of teeth.
Okay, that is not milk teeth.
Okay, so what you are saying actually is you've seen some people that have white chalky patches on their teeth. Is that what it is?
Kindly unmute and let's interact so you can answer that question. Brownish teeth. I don't think he wants to speak.
Okay. If it's just brownish teeth, I will assume you mean the discoloration that is on teeth.
Okay,
that
Dr.
is
Ajagbe,
inherent.
Dr. Ajagbe, let me help here. Hydrogen peroxide does not cause brownish teeth. It will not cause your teeth to become brown. It's not also going to cause discoloration. It doesn't. See, what it provides is oxygen to destroy anaerobic bacteria in the mouth. Anaerobic bacteria are the bacteria in the mouth that are bad for you, and they don't like oxygen. So oxygen kills them. And that's what it does, but it does not cause any discoloration, not brownish, not milky, nothing.
Let me explain a little bit further, Dr. O. You are absolutely right. I think what people erroneously say is that anything that seems to be harsh is acidic, and acid will destroy teeth. So there's something that we call decalcification of teeth, which often develops when people have long-term prolonged plaque accumulation. That is, they don't brush their teeth often. They leave plaque for a long time. And along the gum line or on the tooth surfaces, you start seeing patches, chalky white patches that pick up stain. That may appear as brownish stain. And that may be caused by the acid released by the bacteria in the plaque. That's different. We call that incipient caries in most cases. Now, hydrogen peroxide actually is a whitening device for teeth. Everywhere you go to whiten your teeth, they use a peroxide. They use carbamide peroxide in most of the whitening pastes and gels to whiten the teeth, and they use different concentrations. So that's why you can go to the supermarket or drugstore and buy take-home whitening strips, and it has this carbamide peroxide on it, and then you paste it, it forms in your mouth. They tell you to remove it after a certain length of time. You take it out, you rinse, you say, oh, my teeth are getting whiter. Okay, so it's using the same principle of hydrogen peroxide. Hydrogen peroxide is the weakest of all the peroxides that are available in chemistry. So hydrogen peroxide does not cause the brown pigmentation, which you may be alluding to. But I think the brown pigmentation you are talking about is caused by excessive fluoride in water. You see the brownish pigmentation or the brownish discoloration of teeth from people from the East African bloc. People from Kenya, people from Tanzania, people from Zambia, many, and even from Ethiopia. Those who live in places where their natural water, whether it is well or stream water, has very high fluoride content, and they grew up in that geographic location, their teeth will become mottled. We call that fluorosis. That is excessive fluoride content of the teeth. The teeth are not very beautiful to look at, but they are very resistant to decay. So that was where most people, most of the research studies in dentistry that supports the use of fluoride came into the picture. Like, oh, we see this for people who have inherent ingestion of fluoride in their daily, living. They have more resistance to decay of teeth. Why don't we add some fluoride to our drinking water? And that way we can get a public health issue addressed so that we don't have too many people losing their teeth prematurely. So that would be the only way you have that kind of discoloration, apart from other people that take tetracycline when they were young, when their teeth were forming. Tetracycline stain can cause the teeth to be brown. I hope that helps. I don't want to go too far.
Thank you so much. We have had a robust conversation tonight. Thank you. I want to thank Dr. Tay. He's rubbing it in. Dr. Ebenezer Aduso, brought this up because he saw it on WhatsApp or somewhere and was concerned and asked me. And we felt it was important for us to discuss this because a lot of us use mouthwashes. And we don't want high blood pressure. We don't want the complications of high blood pressure. So thank you so much, Dr. Ajagbe, and thank you, Dr. Izugu, our cardiologist, for chiming in on this to help us see that this is actually really true. It's a fact of life. Again, thanks, Dr. T, for bringing up this subject so we can discuss it on Medical Mondays with Dr. O. So, Dr. Jagbe, if you please give us your closing remarks, we would
Okay.
good night till we see next week, please. Closing remarks.
Well, I just want to say formally greetings from Lagos. So I'm participating tonight from Lagos, and I want to say it's beautiful weather, no heat, excessive heat, and there will be no need to use mouthwash for bad breath and all of that stuff. But I can say of a fact that the discussion tonight, yes, very robust. And I know might raise more questions in the mind of many people. I want to say thank you to Dr. Anekwe for being vulnerable to share that, to see that this is not a fast. This is something that is going on, and ignorance is not, it's not acceptable in this case. And mouthwash, we didn't say is 100% bad at the same time. And just being watchful about it. If you could do something different to improve your blood pressure situation, and that is giving up the mouthwash, I think it's worth it. Because you can still get the fresh breath by using an alternative approach. Activated charcoal mixed with baking soda, mixed with any other spice can help. But I don't need to mix all of those to get very good, oral care by using just baking soda and hydrogen peroxide. And I have numbers of people to back it up. Patients that have given up hope about controlling their gum disease. They've taken antibiotics, they've taken everything, they've done deep cleaning. But just by chancing it why don't you just try? You don't have anything to lose. You're going to gain a whole lot. And they are happy to have tried. So thank you for letting me share tonight. Even though I am 5 hours ahead of those of you on the East Coast of the US, and 8 hours, ahead of those on the West Coast, I'm glad to spend the time with you. Thank you very much.
Thank you so much, Dr. Ajagbe. We appreciate you. We appreciate your time. And I will say, though, that you said you have excellent weather, temperature over there in Maryland. It was 95 degrees today, hot. And they say it's going to be hot like that all week. So you left just at the right time and you dumped us here with hot weather. So enjoy, and we pray for your safety. But
you're very welcome.
Thank you for, on in the midnight. No, this is now beyond midnight oil or the nighttime oil to impact us positively. We appreciate you very much, as always.
Thank you for your attention.
Thank you. I have a question here that I'm going to just, answer, because we've stopped this every which way, I think. It says, why then do dentists here recommend that we and our children should rinse our mouths with mouthwash daily? I'm going to respond that Dr. Ajagbe had presented the new researches in 3 different continents, right, that looked into mouthwashes and saw that it has the potential to increase blood pressure. So we would hope that dentists, as well as physicians, become aware of these researches and start advising patients accordingly. I'll tell you, I give a disclaimer every time I'm called to give a talk at any setting, that the only information that does not change is from Scripture, is the Bible. But when you call me to come give talks, I say it over and over again. I will tell you what research is showing now, what it has shown before the talk. I cannot say what it will show the next day or later on. So something we discussed today, as we discussed it, bring us back next year, and the narrative may change based on new research. We learn as we research and know new facts, and we share that. So that can change. As it changes, that's why we have a forum like Medical Mondays with Dr. O, so we can share it, that this is the new and cutting edge, and we can move with the times to better our health. So I'm sure the dentists that are advising that will still catch on and be able to advise accordingly. But thank you for the question. Adiola says, thank you, Dr. Ajagbe, for your time. We appreciate you. Our attorney in the house, Attorney Richard Williams, said, excellent presentation. Thanks, Dr. Ajagbe and other contributors. Dr. Ethel said, thank you, Dr. Ajagbe, for an excellent and very informative presentation. We encourage all you to see dentists for regular checkups. Our person on iPhone, our family member on iPhone that refuses to put their name, says, thanks, Dr. Ajagbe, for sharing. Sister Shade says, very informative. Thank you, as always, Dr. O, for this platform. Dr. Olutunde says, oh no. Okay, another question. We rounded up. What about tetracycline? I remember while growing up, mother used tetracycline, so might be from that. Now teeth is not smelling, but it's discolored. So teeth stained because of used tetracycline. Is there anything that can be done? No. Tetracycline, when used in children very early on, causes browning of the teeth or discoloration of the teeth, and it's permanent. Nothing can be done about it. It doesn't prevent smelling, though. because, you know, it was antibiotics that was used when the person was young. So another thank you, Dr. Ajagbe, and a big thanks, Dr. O. Dr. Olutunde says, appreciate your kindness, sir and ma. Brother Paul said, thank you for your time and expertise. My sister Daisy, all the way from Atlanta, says, thank you, Dr. Ajagbe. And you know she's a radio personnel. Appreciate your knowledge, expertise, and wisdom. Sister Cassandra Ewing says, thank you for sharing this information, that she will adopt this new practice into her personal hygiene routine and encourage others to do well. Thank you so much, sis. That's the way to go. Our own writer in the house, and she helps others to write books. Diola Atekoja says, thank you, Dr. O, for always providing us this platform to learn and get informed about our health. Dr. and Dr. Ajay said, drink plenty of fluids, stay in an air-conditioned room, stay out of the sun, and check up on relatives and neighbors to ensure they stay cool. This week is extremely hot. In Maryland, it is. By the weekend, will be super hot. Please be advised. Yes, please, everybody take note, because there's a heat stroke that can
wave. Heat wave.
Heat stroke can occur, you know, in hot temperatures like this. So please take the advice. Thank you so much, Dr. and Dr. Ajay. Concelia says it is their first time and they joined late, but learned so much. Thank you all and God bless. Thank you for joining us and thank you for being Medical Mondays family now. You can catch what you miss on YouTube or Facebook. Just search for Medical Mondays with Dr. O on YouTube or Facebook. And the link is the same every week. In case you don't get the link, it is the same. It's the topics that differ. So you can always join 7 p.m. Eastern time. Dr. and Dr. Ajay says, thanks, Dr. O and Dr. A. My brother Taye from California said, good job, Dr. Ajagbe, 2 a.m. right here in Lagos. Oh my gosh, are you in Lagos too? No wonder I called him last night and he didn't pick up. So I think he's in Lagos too. Dr. Mayowa Fawale from New Jersey said, although she has listened to Dr. Ajagbe on related topics before, she learned new things every time. Thank you, Dr. Ajagbe and Dr. O, as always. God bless us all. Amen. Sister Daisy says, thank you, Dr. O, always impactful and life-changing. And so are you, sis. Thank you so much. And, you know, if you go to the chat box, you will see the link to the YouTube if you missed any part of tonight or want to see past episodes. There are lots of them. You will see them on the YouTube and the link is posted there. Sister Keji Taiwo says, thanks, Dr. Ajagbe, for this instructive session. I'm more informed now. I appreciate all planners. God bless you all. Yes. My brother Tai Duarte is in Lagos, going to bed now, 2 a.m. Thank you so much. Lagosians joining all the way from California to Lagos. Please bring me, what should you bring me? Coconut chips and plantain chips. You can mail it from California when you get back. Brother Benjamin Olorunfemi from Lagos also says, I think, says, welcome home, Dr. Ajagbe. Yes, and thanks for taking your time to take us through all that we need to know in respect to managing our teeth effectively. Thank you, bro, and have a blessed night because it's 2 a.m. there. Sister Umi Kamsin from California said, thank you, Dr. Ajagbe, for the great presentation. As usual, thanks to my sister for the forum. Thank you, sis. And can we share this, please? Absolutely. Please share the Zoom link as far and widely as you can, and also the YouTube and Facebook. And please like us and subscribe. Yes. Thank you so much, everyone. It was an amazing time. Can you believe it? Learned so much about water and now about mouthwash. Isn't it amazing? So we meet next week. Please, because COVID is still raging, please keep safe.